Dr. Kim Lam. Welcome to the Medical News Show from Washington, D.C. The hepatitis B and C are the silent epidemics in the United States. According to the American Association for the Study of Liver Disease, more than 5 million of Americans with hepatitis B virus or HBV, hepatitis C virus or HCV. 50% of the hepatitis B virus cases are the Asian American. 1 in every 10 Asian Americans got infected with virus, but many of them don't even know they have the hepatitis infection for years or even decades, until it has caused significant irreversible damages to their livers. In the last edition of the Medical News, we talk about the hepatitis A. Here with us today is Dr. Tran, who is the spokesperson for the Asian Health Foundation. He is currently practicing internal medicine in Falls Church, Virginia. Dr. Tran will continue to share with us the information on the hepatitis B and the update news with this disease. Welcome to the Medical News Show, Dr. Tran.
Yes, hello and welcome to our shows, and hello, Mrs. Lam.
Sir, to continue our conversation about the hepatitis disease, would you please tell our audience again what the function of the liver in our body?
The liver is the most important organs in the abdomen. That's mean the digestive system of the body, because they receive most of the nutrient from the intestine after we eat. And the liver play a role of storing all the nutrient in the form of carbohydrate. And they will store that and release to the body when the body needs it. Secondly, they produce the protein or albumin for the body to use, produce the clotting factors. One of them is very important, is vitamin K. Without vitamin K, the patient can have bleeding when the liver fails to produce these clotting factors. And on top of that, the liver receive a lot of toxics from the food or from medication or from different sources. And the liver cells has a capacity to really detoxify these substances and eliminate to the bile and to the intestine. And finally, the liver produces bile to help the digestive system to metabolize fat when we eat a lot of fatty food. So in summary, I think the liver is the most important organ in the digestive system, because they play so many important role in the nutrition of the body.
So today we're going to talk about hepatitis B. First of all, can you tell our audience what is hepatitis B and where was the hepatitis B virus found?
The virus B was discovered by the Australian scientist. His name is Blumberg, and he discovered because he found in the blood of the one of the aborigine in Australia. So it's had a name, it's called Australian antigen. But back then, he really did not know exactly what the virus looked like and what the function, we can cause a lot of problems. And later, most of the scientists found this is exactly the virus that causing most of the problem, including cancer of the liver. And from then on, I think it's a lot of discoveries, a lot of new things we discover every day, every year about this virus, because amazing, most experts in the world, they focus on that, how to get rid of the virus, and up to now, really, we have a lot of knowledge about the virus B.
So what does the hepatitis B virus look like?
If you look at the screen, you can see on the left side, the tiny little things in the liver cells is the virus B. And then on the right side, you can see real pictures with the envelope, the surface antigen, and in the nucleus we have the DNA. And the DNA is, the virus use DNA to reproduce or replicate. So they use the nutrient in the cells, they use all the calories of the cell, use the protein to replicate, so they can produce million of new viruses every day to attack the body. That's the way virus B survive in the body throughout our lives, from childhood until people get older and older and die, maybe from the same virus.
How does the virus transmit the disease?
The virus transmitted is very important to understand because the virus survive in blood and the secretion from the body, including saliva, any discharge from the wounds and from the genital system. So be careful when you expose the body to these blood, and the virus can stay in that fluid for 7 days. But remember, therefore, the virus can be transmitted to other people by using to share the same toothbrush or needles and acupunctures and etc. But remember, cannot regular social contact and sharing food, maybe not really transmittable the disease, or just simple kiss and hug. So remember, with that idea, we cannot really isolate the patient that they carry disease. Remember, the virus only transmits through blood and the fluid. So if we able to avoid these, I think it's mostly we can protect ourselves from getting the disease from the patients.
So what are the symptoms of a patient if they get infected?
The symptom is very important because this is called silent killers, and the virus there in the body, and 90% of the cases, the mother transmit the virus to the baby, and throughout the let's say it's 20 years, and the virus still in the body, and without any symptom until the body realize that this is the virus in the body. They try to fight back and cause inflammation of the liver and causing acute hepatitis. And the patient develop jaundice, and the patient develop nausea, vomiting, and especially urine. The dark yellow skin and the dark tea urine, that's the signs and symptoms of the hepatitis. It's not just B, but it could be A or C. So these are the symptoms of the hepatitis until the liver become failures and develop cancer. Then patient had different symptoms like abdominal pain and not able to eat or losing weight.
So what kind of diagnosis that you use to detect this virus?
The simple blood test can detect almost everything regarding the hepatitis B, because right now with technology we know that we can identify different stages of the virus. Like on the screen you can see surface antigen mean the virus still alive. Antibody mean the body has an antibody to fight against the virus. And the E antigen mean relate to the virus still growing in the body and very infectious. And if the body have antibody like hepatitis B E antibody, mean the body already in recovery phase and already able to fight back against the virus. But the key of success or the decision making to treat the patient is very much depend on the numbers of virus in the blood. Right now with the new technology, we can detect the virus up until 60 copy of the virus in 1 ml of blood. So if the physician look at the numbers, they can decide whether the patient should be treated or not based on the information. Because right now with technology, we can identify the virus very precisely. Is how many virus is having in the blood of the patient.
So how do you treat hepatitis B, sir?
Throughout the year, over the decade, I think we have the first medication called interferon. Interferon is, from the beginning, is very strong and have a lot of side effects, and most patients cannot really go through on the cycle treatment. So therefore, when the first medication come out, lamivudine, I think it's the most experts believe this the new era of the treatment. But afterward, they found that the lamivudine is not strong enough because the virus is so smart, and they fight back again the medication. It continue to grow in the body until we develop Hepcera much better than the lamivudine. We prevent most of the resistance of the virus. And throughout the year, for the last 5 or 6 years, we had new medications much stronger, called baraclude or entecavir. And then later on, the most recent medication called tenofovir, and the brand name is Variant, is also strong as the paraclet to help to really treat the patient. And very effective, very few side effects, and mostly very successful study about the treatment of Hep B.
Can this virus be completely clear?
Well, the problem with the treatment right now, with all the technology we have, all the new medication we have, really we cannot really get rid of the virus completely in the cells in the liver. Every virus come out liver, we can rid of them by using oral medication. But we cannot go deep into the liver cell to the DNA to get rid of the virus. Therefore, the hepatitis B is treatable, but it's not curable because we cannot really, after we stop the medication, the virus may come back later. So therefore, the recommendation right now that you have to maintain the medication for long term until we know for sure that the virus was completely clear, even though with the help of the immune system of the body, the immune system will push and try to get rid of the virus same time with the medication. But if the immune system is so weak and the virus is still there after we stop medication, the patient has to take long-term medication until we find out another or we come up with a new medication to either to get rid of the virus completely or we can kill them completely in the liver cells.
So there's a lot of patients that given up on the Western medication and they change into use the herbal. So how do you feel about that, using herbal medication?
Well, this is right now with a lot of herbals and very very popular now in United States and other country. But really in this country, and the only I know that the Federal Drug Administration called FDA has a lot of application for herbal to be approved for treatment of Hep B or C. But unfortunately, so far we don't have any really scientific evidence or study, well controlled or study about herbal medicine to use to treat the Hep B. So far, to answer you that question, we don't have any really herbal really approved for treatment of Hep B. Herbal, if you use in natural sources, be careful because it may happen or maybe causing some more problem for the liver as well. Because if you use the herbal incorrectly, instead of helping your body, it may cause a little bit damage to the liver as well. Because the herbal also has some side effect. It's not really, it's non-side effect herbs.
So what are the most effective way to prevent this virus?
The best way is to know about the disease and to learn about that, read that, and look at up the internet or whatever the sources, because it's very popular right now, especially Asian community. So you try to read that to learn about the virus, and then try to prevent it by not sharing needles and not going acupunctures and whatever there, and in order to prevent yourself from contact with the sources of the virus. But the most important thing is for now and the past and the future that we have to focus on the vaccine for all the children in the United States, in the world, especially Asian area. And also, I think it's very simple because a very effective vaccine right now, we just need 3 doses in 6 months, the first dose, second dose in 1 month, and later 6 months. I think we can protect most of the people from that. But be careful. Before you go to the vaccine, you better have the blood test screen for hepatitis B. If you're exposed to Hep B, then you may not need that. If you have antibody, fight back against Hep B, you don't need the vaccine. Only when you have no contact with the virus before, or you have very low level of antibody against the hepatitis B, then you will need the vaccine. So the vaccine is applied for people who never exposed to the virus, for children never exposed to the virus, and for people with very low antibody against the virus.
So earlier you mentioned that the baby was born by infected mother might get affected with the virus. How do we prevent that?
To prevent these children right now, we have two. Yeah. The baby was born with the mother infected, that we know. Then the baby had to go to the vaccine right away. and they go to get the medication they call hepatitis B immunoglobulin, a form of antibody that inject to the body of the baby because they have no immune system, not mature enough to produce antibody against the virus. So we have to use the injectable antibody to help the body to fight back on the virus from the mother transmit to them. Yeah.
You said earlier that the vaccine is very effective. Can you tell us a little bit more? How does the vaccination work in our system? How does that fight back?
The vaccines in general, usually we use some of the form of the virus, either the capsules of the virus or the virus get already decrease the strength, or we use heat to kill the virus and then inject in the body. When the body recognizes something to strangers, enemies, it will produce antibody to fight against that. And first time they realize that they produce a little bit of antibody. Second time, second dose called boosters, the body reacts strongly and produce more antibody. So the third time in 6 months, if we give another doses, the body reacts very strongly and produce enough antibody to ready to fight, and they fight in the future. So in the future, if that person exposed to the virus, the body already have the big army to fight against the virus. I think that's the key of the vaccinations applied to any form. Yeah.
That is all the time we have for this medical news show today. So thank you for being with us, sir.
Yeah, it's just thank you for watching our shows today about Hep B, and again thank you.
You're welcome, sir. Thank you, sir. That was Dr. Tran who just shared with us on the hepatitis B virus and the update information on this liver disease. In the next edition of the medical news, we will talk about hepatitis C. What are the complications of this virus? How can we prevent it? And what kind of treatments are available today? Is the virus C more dangerous than the virus B? Please stay tuned for these answers on the next edition. We hope the information provided by Dr. Tran has shed more light on the liver disease. That is all the time we have for the medical news show today. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the medical news show. Until then, have a great one.